Good evening. I am Dr. Arunesh Kumar. I am Senior Consultant Pulmonologist at Paras Hospital, Gurgaon. I also work at Miracles Mediclinic and at Sector 56 in Gurgaon. Today I am going to talk to you about asthma. As you know, in Gurgaon, which is one of the most polluted cities in the world, and that's official now, asthma is becoming more and more relevant with the time. Asthma is a disease which is traditionally been attached to the allergies. So your airways become sensitive, and if you inhale the pollen or the dust from outside, it creates an inflammation within your lungs that produces symptoms like cough, breathlessness, and characteristic whistling sound, which we call wheeze. Normally, asthma is a disease of childhood, but with the increasing pollution and the change of weather and change of the atmosphere as such, this is more also becoming a popular disease in adulthood, as we call them adult onset asthma. There are many varieties of asthma, and we as a pulmonologist try and phenotype them as to which type of asthma you have got. Asthma is very characteristic, as it can get better very early, as at the same time it can get worse very early. So it's very important that we look after this disease well. Normally we prescribe bronchodilators, or the pumps or inhalers as we call it, to have a good control of your asthma. There are two types of pumps. One inhaler is essentially, we call them preventer inhaler, which you should be using every day. That keeps a tab on your disease and doesn't let it deteriorate. And other inhaler is called reliever inhaler, which you only take it when your symptoms get worse. It's important that you heed to your doctor's advice and take the inhalers regularly to keep a good control of your disease. Should you notice any deterioration in your symptoms, like your cough is getting worse, you are more and more breathless despite taking your inhalers, you should seek early opinion from your pulmonologist, so that things can be done early rather than waiting for too late for you to be admitted into the hospital. In addition to the inhalers, the doctor will also prescribe you some tablets to keep your airways open, and it's very important once again to keep to be compliant with the treatment. Now it's very important that patients with asthma get regular review with the pulmonologist, and I recommend that if you have had a previous hospital admission, you should at least be seeing your pulmonologist every 6 months. I also think that you should have an asthma action plan in place, which essentially tells you what you should be doing should you lose the control of your disease, which essentially tells you to keep a tab on your disease and seek early medical help if required. Now, if you have got a diagnosis of asthma, and if you are a smoker, you should think about stopping smoking, as there is evidence now that if you are a smoker and have got an asthma, there is every chance that your asthma can turn into COPD, which is relatively worse disease than asthma. It is also very important that you should keep up to date with your vaccinations. So there are two vaccinations available for patients with asthma. One is a pneumococcal vaccine, which are of two types. One you take when lasts for lifelong, and another one which you repeat every 5 years, and a flu vaccine which you take every year. Once again, if the crux of the asthma management is being compliant with the treatment and be in contact with the pulmonologist regularly. I hope that this talk helps you with your asthma disease control. Thank you very much.